So we now understand that you can't just take any moisturizer, you can't just take any serum, any product and start microneedling it in, because it will go in. And number two, if you don't make the choice, your risk of granulomas, your risk of infection, your risk of creating complications is guaranteed. So unless you understand the full complexities of biochemistry, of cosmetic chemistry, molecular weighting, pH, and your source and your form of active ingredients, then this is why your DP Dermaceuticals MG collection now remains a predictable, reliable, safe, procedural outcome. Let's take into consideration, if you have a product or ingredient and you do not know atomic mass or molecular weight, and you force something of large molecular size into the skin, it will get stuck. For example, those of you who work with filler. A filler which augments the chin and jawline, which augments the cheeks, is probably around about 2 million kilodaltons. And the reason why it has that molecular weight and size is so it creates durability, but can also recontour the face. If you use that same filler around the tear trough area, you're going to see two big sausage lines in the under eyes, because the filler, the molecular weight, is too big for the area that you've injected it into. If, again, you use an augmenting or recontouring filler for the lips, you're going to find that the lips look overblown, overtreated, and very, very tight and severe. So we need to understand molecular mass. The smaller the molecular weight, uncross-linked molecular technology now allows for free and easy movement within the skin, but also facilitates a smooth and effortless glide with your DP4. We also understand that there is a big difference between what is topical and what is designed for infusion into the skin. Just as you would not inject a jar of moisturizer into a patient's face, you would not inject a topical serum into a patient's face, it's the same with your DP4. Watch what you put into the skin. Understand pH. If you start infusing a product with a lower pH, you will create carpaccio. You will start cooking the skin. If you use the wrong chemical form of an ingredient, this will also be problematic. Consider pure vitamin C, ascorbic acid, a pH of 2.2 under normal circumstances. It's going to burn the skin. There is no benefit to this. This is not the philosophy of your skin needling. This is a risk for post-inflammatory hyperpigmentation. So this is why we move into esters, including magnesium ascorbyl phosphate, sodium ascorbyl phosphate. Other areas of consideration is you want your product to be sterile, you want your product to be aseptic. This delivers safety, removes the risk of cross-infection, but now also physically promotes a predictable, reliable outcome without your patient experiencing unexpected post-operative challenges. And finally, for consideration, this is the value of your MG collection by DP Dermaceuticals. We have done all of the pre-work to create the most superior, the most active, the most effective solution and complexes to now give you the ultimate pinpoint precision for every patient, every time, for every indication, but to now also maximize the benefit of both mechanical regenerative medicine with the benefits of chemical regenerative medicine. This is the versatility, the concentration, but the innovation of the MG collection from DP Dermaceuticals.